Hello there, fearfully and wonderfully made human. Welcome back to the Holistic Counselor podcast, where we explore the intersection of faith, science, relationships, and whole person healing. I'm Diana Rest. Diana Rest. Oh, really? I need some rest. Diana S. Rice, licensed mental health counselor, founder of Through the Valley Therapy and Transform Mind Consulting and Coaching, and your host. And I'm really glad you're here today. For those of you who've been listening for a while, thank you. This podcast is completely independent, no sponsors, and each episode takes about 3 to 5 hours to prepare, record, and produce with care. So, if this show has supported you, one way to help to keep it going is by leaving a review or check out the merch link in the show notes. Now, on to my guest. I met today's guest, Dr. Marni Feuerman, at a local networking event, and we had one of those conversations that reminded me why I love connecting with other clinicians. We started talking about her work, and I remember thinking, okay, wait, pause. I didn't want her to tell me everything right there because I wanted to bring that curiosity into this space so we could all learn together. Today, we're talking about emotionally focused therapy, EFT, a powerful evidence based approach to understanding attachment, emotional safety, and connection in relationships. This is actually the first time we're doing a focused conversation on this EFT, and I'm looking forward to it. Dr. Feuerman is a psychotherapist based in South Florida with specialized training in couples therapy. She's a clinical supervisor, author, and a widely respected voice on relationships, sharing her expertise through outlets like Very Well Mind, HuffPost, the Gottman Institute, and her own writing. She's also the author of Ghosted and Breadcrumbed, Stop Falling for an Unavailable Men and Get Smart About Healthy Relationships, which helps women recognize unhealthy relationship patterns and move toward more secure connection. Marni or Dr. Feuerman, thank you for being here.
Thank you so much, Diana. I'm so excited for this conversation.
Yeah, me too. I love learning new things. And, even though, we try to learn everything we can through experience and our
Mhm.
schooling, but that's why we have niches. And so I'm really excited to learn about yours. So, but before we dive in there, can you just
Mhm.
tell me a little about who you are, your work, and what led you to emotionally focused therapy?
Yeah, sure. So, as you said, I'm a licensed therapist. I have a private practice in Boca Raton, Florida, and I've been in the field a really long time. It's been like almost 30 years, I realized. So, starting out in a more general way, first job out of graduate school, working in on a psychiatric unit, and then eventually primary health care. So, getting a really good foundation. And then got married myself, had kids, and just developed an interest in marriage and family therapy from there. So eventually went into private practice and just learned a lot more about working with couples and also working what's called systemically, which I know is like a clinical word, but just basically means how relationships impact each other, how these dynamics and how people relate to each other and all of that. So that's what systems are about.
Yeah.
And so I just kind of honed that skill a little bit more. And then a colleague and friend actually got me interested in emotionally focused therapy because she was just describing it to me and I hadn't really heard of it before. And so I decided to take some training in it. And I just felt like it made so much sense to me. It just felt
Yeah.
really organic. It felt like the right fit. It's like a map for love and relationships. So it gives therapists just that, clear way of working with people and how people impact each other. And it had a very high success rate, which really impressed me. And there's a
Mhm.
lot of research. I think it's the most researched form of couples therapy, and there's a lot of outcome studies. So that means that they looked at people that went through a course of emotionally focused therapy,
Okay.
and they found that there was a very high, like something like 70%. So that's really, really high, as
What?
for this kind of work.
Yes.
And yeah, so that appealed to me. and that also that changes stuck with people. So when they made changes, they made gains, they didn't just lose it once they walked out the door. So I
Right.
feel like the changes people make go beyond surface level as well. It's like deep first order type change.
Okay.
And
And this is for
EFT.
couples.
Well, yes. Well, this is another little element here is that it started out being an approach just for couples.
Okay.
But eventually, and I would say this was maybe within the last 10 or 12 years or so, so it's pretty recent, where it's been expanded for families and also for individuals. So
Oh, we're
we
gonna.
now have couples, individuals, families. We have all of those sections of it. And I've learned all of it. So because again, it's a natural segue into these other modalities. So
Yeah. So
yeah.
can I ask, because you're Dr. Feuerman, what's your degree in?
Yeah, so I have a master's in social work, and then I also have a doctorate in clinical psychology, which I
Okay.
got a little later on in life.
Yeah.
So that was kind of nice in that all of my coursework, I could just continue on the path of learning more about how to help couples.
Yeah. And I think that's the difference too of like social work, marriage, family therapy, and LMHC, mental health counseling,
Mhm,
because
mhm.
those approaches are different. Social work, of
Yeah.
course, it's social, like seeing the systems out
Mhm,
there.
mhm.
MFTs, it's marriage, family. They focus on that. And with me, it was more individual, like what's in the psyche, psychoanalytical, like, things like
Yes,
that. Even though they all are under in Florida under the
one
same
license.
board. And
Mhm,
and that's to me why it's important to have these conversations because honestly, I'm already thinking of people like that
mhm.
ask me for, I'm like, no, I don't do couples. But now that I know, like, oh,
Right.
okay, let me know about more about this emotionally focused therapy because if it's something that goes, oh yeah, my clients will actually like that or want to know more about that. So tell me, because honestly, my whole time I thought EFT was that tapping. So
Yeah.
now, please explain the
Yeah.
differences.
This is a frustration, I think, with EFT tappers and EFT emotionally focused therapy.
Imagine.
It's like a little battle. So it's kind of funny, but they're so, so different. So EFT tapping is called, and I don't know a tremendous amount of EFT tapping, but what I
Yeah.
do know is it's called emotional freedom technique.
Hmm.
It's like a tool that is taught to someone that where they're tapping
Yeah.
certain acupuncture points
Points. Yes.
to relieve stress, anxiety, trauma. I know it works in a lot of different capacities. So it's
Yeah.
kind of like a specific tool. So
Right.
that it's very, very different than emotionally focused therapy, which is a talk therapy that's
Okay.
based on the science of bonding. And it's very relationship focused and it's about the connection between people and about negative interactive cycles or patterns. And it's also grounded in attachment theory, which I know is, something that a lot of people are now, learning about. A lot of the lay
Yeah,
public is
that book
about attachment
attached.
theory.
Yeah, the book attached. And
Yes.
people are, with TikTok and Gen Z and
Mhm.
millennials having so much more information that I have no idea how old you are, and I'm not going to ask you, but I'm really honest about me. And it's just like we had none of that. Like
Right. We didn't have
it
any
was
of that. I didn't have
Freud.
any of that
It
either.
was Freud, and that was about it. Psychoanalytical and CBT came into the forefront and stuff, and then how I learned. But I'm really curious more about emotionally focused therapy. Like, who
Sure.
invented it? Where is it from? Is it from USA? Is it from Europe? Where, I mean, tell me all about it.
Yeah, so it was started by a Dr. Sue Johnson, a phenomenal psychologist. She was born in England, but she was, I guess, raised in Canada. So it came out of Canada where she established emotionally focused therapy. And at first, she did it with another gentleman named Les Greenberg.
Mhm.
They did a lot of work together to kind of discover um, how emotions prime behavior, motivate, how we interpret things. Emotion is the foundation of it, hence it's called
Okay.
emotionally focused therapy. So she broke off a little bit from him and did because I think it was more individual stuff. And she was very interested in couples and in romantic relationships. And of course, way back then, she got no funding for her research, right? Because
Okay.
they're like, you want to study love? Ha 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 ha. I mean, she got laughed out of places. So, but she's so brilliant and, in my opinion, just
Mhm.
learning certainly her method. She has since passed away, I think about a year or two ago,
Oh, wow.
unfortunately, but there's a lot of people to carry on her fantastic work, and there's more and more research and more developments in it and all of that.
Mhm.
So she was interested to know what was going on with couples. They'd be sitting in her office, and as you know, as couples do, fighting and having a difficult time and being in distress. And she really tried to pinpoint what was going on, what was happening with them, what was creating some of these negative communication patterns, as she would call it. She noticed that some people would pursue, and when one would pursue, one might withdraw. And with one would withdraw, what would the other partner do? And she was always just mapping these things out. And then she also realized that early childhood attachment patterns that are formed by interactions with caregivers would establish what we call an internal working model or a template for how we believe people are going to show up for us and
Mhm.
whether or not we can trust them. And that this would get very reactivated in adult romantic relationships. So these early patterns really inform how you view intimacy, trust, conflict, and that a lot of our it's also about the biological survival strategy that's really wired in,
Mhm.
where we're wired for connection. We need people, right? We need
Yes.
just like a toddler needs like a secure base. They need to be able to go play and look back and see mom is there, and it lets them feel more independent in the world. We
Mhm.
also want to know that our partners are there for us,
Right.
and it's just how our different emotions are activating, right? And that emotions are kind of the change agent, or what we're looking at to understand people's moves in these different patterns and in these different interactions. And that's the heart of what EFT is about.
Wow. A lot of couples think they're fighting over like money. I mean, this is what you hear too.
Yes,
Money,
of course.
communication, chores, sex. But from an EFT
Mhm.
perspective, what are couples actually fighting about underneath that's the surface?
Yeah, so according to what Dr. Sue Johnson had, developed in research, she realized that what people are really fighting about is whether or not they feel like they matter to their partner and that they're
Wow.
enough and that they're worthy. So after a lot of work and a lot of tracking, often it gets drilled down to people's what we call attachment fears, right? Because usually the dishes just become a non-issue, or the air conditioning, or where they're going to go on vacation. All those things kind of become non-issues if you know you are safe and secure in your relationship. So you have to look at it almost like a protest of disconnection, gets ends up in some of these very topical issues, which some of them are definitely important things, right? Like we have the top list that you just described, sex and finances and
Right.
in-laws and things like that. So it's not that those issues aren't important, but we're looking for what is the pattern between the couple that keeps them from effectively discussing that issue. So whereas some approaches might give tips, like, hey, let's create a chore chart, you guys will stop fighting.
Right.
This
Right.
is why that doesn't work, right?
Yeah. For
Because
for a for like, a month, right? And then all of
exactly.
a
It might
sudden,
work for a month, but
yeah.
we want to get to the core issue. What
Wow.
is creating perhaps a sense of insecurity, in this relationship? And that I like to use the phrase like low hanging fruit a lot.
Okay.
Like the dishes were that was just like the low hanging fruit to fight over.
Yeah.
But we have to figure out what's getting activated under the surface. And often we find that we can trace it back to these early attachment patterns that we just spoke about.
Mhm. So is it like, because I'm thinking I've gone to couples therapy with my husband,
Mhm.
and in different modalities too.
Okay.
I've been married for 30 something years, and that's the thing. It's like things happen and you need that third party to come in and say, here's a new tool, or hey, this is what's actually happening. I never went, I wish I would have went to EFT. Maybe I will. Hey, Jim, if you're listening, guess what? Because to me, no matter what, like even if we're getting along at the moment or the time, things happen. It's a roller coaster ride being in a relationship with anybody,
Yes, that
right?
is true. That
Right?
is true.
Even with
Everybody
yourself.
has a cycle. I mean, if you think
Yes.
about it, who's the one in the relationship that tends to bring things up more? Who's the
Right.
one that avoids the conflict? Who, like, there, it's when it gets highly distressed that they
Hmm.
can't figure out how to get out of the cycle is where a therapist, like an EFT therapist, would come
Yes.
in because sometimes cycles are really complex and complicated and people don't send clear messages and signals to each
Right.
other.
And there's other things happening too. So I like that you're saying that you go deep into patterns
Yes.
and mapping. So that's what I want to understand because I know many different modalities have different protocols or like say EMDR has these, the 10
Mhm.
questions and they're trained in certain ways of doing this or Gottman, you have that kind or
Yeah.
CBT or, because people that are listening that have no idea about therapy or they're
Hmm.
just learning and we know the language because we're in it. I want to understand, like, if someone were to come see you, what is the protocol? What is it that you do differently than, say, anyone else that's just doing talk therapy?
Good question. So there is a general protocol, we'll call it. There is certainly some structure,
Okay.
but I would call it very fluid and very semi-structured because of the the information that I'm being given is of course always different for every couple, and somebody's internal emotional world, right? We all have our own, right? And it's very
Yes.
complicated. So it's kind of like I heard this recently. I'm like, this is what it is. It's like we collect the dots and then we connect the dots.
Oh, wow. I
So
love
I
that.
love
Wait, we
that.
got
I'm
to
like,
say that.
that's
We got
what
to
it
say
is.
that again. And,
Yes.
and, and did you make that
Yeah.
up or you heard it from
I
someone else?
didn't. I heard that, but I'm like, I'm stealing that.
Yes. I
So
love
collect
that.
the dots and connect the dots. So I want
Okay.
to understand what is setting off a particular set of reactions, right? So in EFT, some of the structured elements might be what's the story you're telling yourself about that? When you saw the look on your wife's face, what did you say to yourself? What meaning did you make of that? And
Okay.
then what did you notice you felt? You said, again, they'll say they're always telling me stories and they're always giving me examples. And that to me is just a launching point. But let's say the husband says, well, when she gave me that look right away, it was like, I'm kind of dumb and I don't know what I'm talking about here.
Hmm.
Oh, wow. So you told yourself you're dumb. And is that when you just told me that that's when your voice raised and you kind of yelled back at her? Yeah, and then I yelled back. And then when you yelled back, what happened? Oh, I noticed she just stormed off. All right, now I'm starting to get some sense of their pattern. And they might tell me something very similar, whether they're talking about the groceries or whatever, again, the topic.
Yeah.
But I'm just tracking and mapping some of that pattern. And I do want to know, the meaning that they made, what is their protection? So what did
Mm.
they do? That is usually a reactive piece that kind of comes out, a behavior.
Right.
What is the emotion underneath it? And then I'm helping them the shift and talk about it with each other as well, but I'm very specific about what I'm having people turn and talk to each other about. And that we call an enactment, meaning that rather than just talk to me, I'm then having them turn and talk to each other uh, because I'm kind of extrapolating some more information, some more details, some more emotions. But if they just talk to me, they're not going to learn then how to talk to each other when this comes up.
Wow.
And
Yeah.
so that's an experiential portion of EFT,
Hmm.
which again helps people learn it in their bones and remember it. It gets down more into the muscle memory. So some
Okay.
approaches are much more cognitive and they're just
Yes.
talking, and they're talking to you, and of
Hmm.
course their partner's hearing it. But it's a whole different thing that gets activated as well when you turn and you look into your partner's eyes and you're saying something softly like, hey, I suddenly felt like I was really stupid there and that you didn't trust me anymore when you said XYZ or whatever, So they're sharing, they're talking, and I'm certainly processing through the enactment to,
Right.
again, it's like slow, gradual,
It sounds like
push in the direction.
like you're there facilitating neuroplasticity, where you're putting
Exactly, exactly.
neurons together, whatever fires together, wires together.
Yes.
So to me, that's really important how you're doing that. Because I know when I went to
Mhm,
I did couples therapy and family
mhm,
therapy back in the
mhm,
day for a minute, and then I
mhm.
realized, yeah, I'm not, I'm better one-on-one, and I don't want to be a referee. So how do you deal with
Yeah.
that? Because that is something
Yes.
that many people are confused. Like, okay, we need to go see a therapist because automatically
They
both
think,
people come in want to be
yeah.
right,
Yes.
and
100%.
and then they're using you to be like after they leave. And I hear the stories
Yes.
from other colleagues or people that have gone to therapy or they ask me
Yeah.
questions. And that's it. They're like, oh, the therapist said you did this. And that, or they utilize us to be like, you know what I mean? The scapegoat of things. How do you handle
Yeah.
those intense situations?
That's probably one of my favorite parts about doing EFT is we don't have to blame anybody. I mean, yes, there's certainly a few very rare exceptions, which I know we don't necessarily have time to go over, but in a vast majority of the cases,
Hmm.
and people are coming in saying we just can't communicate or we don't communicate well. And
Hmm.
what's great about EFT is it really removes the blame because we look at that pattern or that cycle as the common enemy, and we want to shift people's perspectives to that so that they realize that, hey, this cycle is doing this to us. The cycle is making us disconnected or reactive or lonely, or right, because we had 10 different back and forth moves or triggers, right? And so I'm helping to track and reflect that, and eventually when people start to internalize that side of it, they can calm that pattern down when they start to do that. So one of the very first, I guess, initial goals in, I'd say the first phase of EFT treatment is the de-escalation, as we call it, the de-escalation of that negative cycle. So we can start to calm that cycle down and they can start to take more of this aerial view to see it as the pattern and that they can externalize it. They can blame that. There's no reason to blame each other. Blaming each other is going to do nothing but activate the negative pattern that they're trying to get a hold of.
Hmm. How do you handle, because this is what's coming to me, like I'm
Hmm.
thinking of couples, a lot of different couples, situations that I've heard in the past. Like, how do you deal with someone that's cheated or someone that's a narcissist or,
Hmm.
because sometimes you get couples come in and there's
Yeah.
situations where I'm sure as a therapist, you're like,
Hmm.
oh, okay, this is a
Yeah.
situation that, how do you handle that with EFT?
Yeah. So those are very real complications that we often see. So I, again, I mean, if I just completely blame one person, I'm not looking at things systemically. I would in no way, shape, or form blame someone who was cheated on, or if, the recipient of really terrible abusive behavior or whatever. I'm not, certainly gonna um, help that person assert themselves and have a voice and all of that and be supportive of that person. But I also want to get a much broader understanding of what is activating that type behavior. If
Mm.
somebody is cheating, or drinking or whatever it is, they have some type of an addiction, or they get so activated that they're screaming names at their partner. Um, I want to look at what is going on with that person. Again, their emotional world. Is there trauma that it's activating? It's going to fuel, if anything, a really, really strong negative cycle, right? A
Yeah.
very activated, highly distressed negative cycle, but still a cycle, still a pattern. So by tracking that, it helps somebody own and see their move in the pattern. Okay, I
Right.
know when I scream and I call you a name, it doesn't get me what I want. It has you moving away from me. I'm really wanting to be heard and understood. But when I act this way, the opposite happens. So think about if I'm able to track that and point that out and help people see that they have to find another way to communicate and they have to do it in a way that creates safety. So emotional safety is always the first order of business. So if I can't create that, we're not going to get through the end of happily ever after. We're not going to get there. We're not going to get
Yeah.
there without creating a tremendous amount of emotional safety. And so I'm always wanting to do that. And then some cases we know are very triaged in the beginning. Someone coming in right after an affair discovery. That's
Yeah.
very different, right? Than just launching into like, oh, let's just look at your communication pattern. Like
Yeah.
obviously there's something I have to front load first to create some much more safety and stabilization. But eventually, we're going to get to probably more of the traditional work of EFT. But I still have a great framework. Like even when I'm dealing with some of those really challenging, complications like you just mentioned,
Mhm.
and I got to see, I got to evaluate, right? So like every form of therapy, individual, couples, families, whatever it is, we're always starting with a thorough assessment. And it's the
Right.
same thing with EFT couples therapy. So my first session is with the couple together, and then I
Mhm.
always do one individual session that's part of the assessment process where I
Okay.
can get
For
one.
each. Okay.
Yes,
Because I was
with each.
wondering about
Yep.
that. Yeah. How
Because
you
I'm
do
always
that.
assessing for safety.
Right.
I want to get a lot of context about what people are bringing into the session with their partner. Family stuff, past romantic history. I'm learning about attachment. Who do they go to when they needed help or
Yeah.
were in trouble? Were either parent available to them? Was one
Hmm.
parent and had an addiction issue? Like what's going on that then that you're bringing into this
Okay.
relationship, and it really helps me a lot. And then if I'm thinking that one person or they need some other service or
Mm.
one person may need some other kind of treatment before engaging in the couples therapy, I'm making sure I'm assessing and making an appropriate recommendation for that.
Mm.
Because there are, a handful of contraindications to any couples therapy. So I'm making sure that the couple is, certainly aligned in their goals and that we're able to just hit the ground running and do some work.
Okay. And I was wondering too, is that if, say, you notice that the couple comes together and then you're doing the couples therapy, if the individual needs like individual therapy, do they both do it with you, or do you go outside and say, "Hey, listen, I think you need to do both. Like be with me as
Yeah.
couples therapy and do your own individual stuff with someone else." Do you
That
what?
does happen, particularly with some complex type cases.
Okay.
I always see what I can do in the couple's work, but at any point, I might be referring them to individual therapy as well concurrently. It
Right.
just, it depends, right? So
Yeah.
assessment can occur all along the way, just as I'm learning about people.
Hmm.
Sometimes people come in and they're not ready to talk at all about something really traumatic that happened to them.
Right.
But yet, oh, session 10 or 12,
Right.
wow, we just hit on something that I'm learning that is, really preventing this person from being emotionally accessible to their partner. And maybe they
Right.
do need to work that particular issue
Okay.
out in individual therapy. So
Right.
I absolutely can make that recommendation. I would say as a general rule, I really don't want to do both, but there's
Right.
been, I would say, some very rare circumstances where I might have one or two sessions individually to
Hmm.
tease something out. And that's, of course, with both partners consenting to that. But for the
Exactly.
most part, I really try to avoid that. I look at the relationship as my client, and I want
Hmm.
to keep it that way. And I don't want to do anything that's going to undermine that.
Yeah, for sure. And for the audience, because guess what? Many people confuse emotions with feelings.
Right.
So
Right.
so
Feel,
let's
yeah.
explain that a little too, because
Yeah.
I'm feeling
Hmm.
this, I'm feeling sad. Well, sadness and emotion. Like how do you,
Yes.
there's the feelings wheel, which I worked with
Yeah.
alternative high schools with teenagers most of my career. So
Hmm.
that's the language I speak. And so but people
Yeah.
get that confused a lot, the
Right.
feelings wheel and the emotions. Can you explain that a little bit?
Yeah. Absolutely. So think of emotions as way more broadly. And there are, I think, six or seven core emotions, and everything else falls under the umbrella of those core emotions. And when I say emotion, I'm not just talking about like feeling as a component, naming the actual feeling,
Mm-hmm.
but that it also has a very physiological component to it. It has a meaning making component to it. It also can draw on some of our historic experiences are kind of painted in it. So look at it like it's multifaceted, is emotion. Feeling are usually, I try to think of one word.
Yeah.
So whereas anger could be more of an emotion, I mean, it could be a feeling too, but let's say anger has an intensity to it. And inside, I feel wronged, something's unfair, right? So it's got a thought component. But if I want to break it down and I want to get granular about it, the more descriptive we can be about what we're feeling, the more we're able to communicate. So maybe I wasn't in a rage, right? But maybe I was frustrated. Maybe I was irritated. Maybe I was upset. So those are all feeling words that might be under an umbrella of something like anger.
Right.
Both are important. I don't think people need to necessarily know so much technical info because I kind of feel like that's our job a lot, right? When we
Yeah.
are sitting across from a client, right, our job is to help them articulate their inner worlds and
Right.
their emotional experiences and their, and the why of why they're doing what they're doing, why they're behaving maybe in ways that push people away
Hmm.
or whatever it is. So
Right.
I feel like that's a bit more on us, but the more people can learn about feelings and emotions and all that stuff, it's all really helpful. It's all good
Yes,
stuff.
it is. It is. And so I just want to go into a little bit now that I realized that you wrote some books. Or is
Yeah.
it, or so tell me
Yes,
about
I wrote
that.
one book.
Yeah.
Yeah.
Okay, so that title's the whole title.
That's the whole title. I know it's a
Okay.
mouthful. It's the whole title of one book that I
Okay.
wrote.
Tell me about it.
Um, so that came out of, I do have a lot of freelance writing on various websites, and a couple of articles that got a lot of attention, a lot of shares and views and all of that, was based on women who were in relationships with men who were unavailable, even sometimes they're affair partners, so they're choosing like an ultimately unavailable man,
Hmm.
and also relationships where there was emotional abuse. And so I thought, what could I write for women to really help them make better choices and get healthier in their relationships, particularly when they're repeating patterns throughout their life where they're choosing um, men who I'm calling unavailable, right? They're
Right.
emotionally unavailable, sometimes they're physically unavailable,
Hmm.
but they're putting up barriers to intimacy. And so I wrote the book for women who find themselves in those types of situations. Like, what's it about? What's going on? Um, to look at themselves, especially too, not just blame the men, right? If you just
Right.
blame them, that's not doing all of the work, right? Like you're
Right.
making a decision, it may even be unconscious. Why are you
Mhm.
drawn to somebody who can't meet your emotional needs, right?
Right.
Doesn't make for a really rewarding and thriving relationship. So the book is geared towards women in those circumstances,
Is it like a
particularly when they're
workbook?
dating.
Is it like a
It's
workbook?
it's not a workbook.
Okay.
It is a self-help book,
Okay.
but I am in the midst of trying to develop a workbook
Oh,
as
cool.
well. So to kind of make it just even a little more,
And yeah,
skill
helpful.
set oriented to help
Yeah.
guide women through this.
And does it have EFT in it? You know what I mean? Like, is it like
Yeah.
some of the I mean,
Absolutely. It's
okay.
grounded in a lot of EFT. I also
Okay.
draw from some other methods as well, other approaches. I would call it integrative, but the foundation of it is definitely emotionally focused therapy, interpersonal neurobiology, attachment science, all of that good stuff that we have, to really help us
Right.
understand love, understand these choices, understand what we're doing. So yes, it is grounded in that. Absolutely.
Can it help someone prevent to, say, someone that's young and dating and they're looking, or,
Mhm.
is it just for women or could a young guy that's starting to date learn from it too?
I do. It's funny because I think a handful of men have read it and have
Okay.
gotten stuff out of it.
Oh, good.
I did make it more for women, but I would say, it's for anybody who wants to understand themselves better,
Okay.
maybe as prevention. So I do
Yeah.
think people would get a lot out of it for that. Or if they've, let's say, been in one relationship their whole life and it was a really bad relationship and they've just got out or they just got divorced. So it's generally for single or divorced women,
Okay.
because I feel like, if somebody's married, that to me is like a different circumstance. I don't want to mess with,
Yeah.
help me make a decision about your marriage. That requires expert help, for
Right.
sure. But for people who are single and trying to make choices and decisions about who to let in their life, particularly in a romantic way,
Yeah.
and make healthier choices.
Mm,
So,
yeah.
or they already know because let's say they had a really disastrous family situation and they're like, I'm starting to date and I want to be really careful. I could see it being very good for that woman as well.
Oh, good. I think I might have to get a few copies for some people.
Yeah,
I
yeah.
know. Oh, okay. And so say there's somebody listening now and they're not in couples therapy. This podcast I try to create it to break stigma in churches and in the Black and Brown community.
Hmm.
And because many people, there's such a stigma still in those spaces. And couples therapy right now, because many in some high control religions and stuff, it's like no matter what, this is how it is. Like you gotta or there's such a pattern of like, I'm over you and that's it. And this is how it should be. Or, I mean, I could probably sit here and name a whole bunch of different situations, but I want to
Hmm.
know, like someone that might be listening, are there simple EFT inspired shifts, like emotional attunement or responsiveness that people can start
Hmm.
practicing today? Like things that they might be able to start understanding to have a better relationship? I mean, I know I just named like hardcore abusive relationships, but there's
Yeah.
people that are just don't
Hmm.
know, honestly, and they want to know, and they're just don't know where to start. So, like, what would you say to them?
Yeah. Yeah. So, um, you kind of also just mentioned something that I think is also good to say, which is that EFT really is a very culturally sensitive model.
Right.
And we want to understand people's experience and their history and what they bring into the relationship, how they face the world, right? And we know people have been sometimes like you're describing, maybe not treated well, not treated well by the world and groups of people and all of this stuff. So I really like that we're so respectful of, you know, your worldview and what you're bringing in and what's happened to you. So I just want to say that part of it. I would say one acronym that Dr. Sue Johnson wrote in like a book that's geared more towards a lay audience that I think
Mhm.
is great to read. It's called Hold Me Tight. In
Okay.
case anybody's interested, and it's based on EFT. It's a really excellent self-help book for couples, and she uses the acronym ARE. So ARE stands for accessible, responsive, and engaged, right? So are you accessible to your partner? Available might be a good word too. Can they find you? Can they reach you? Are you there for them? Okay. Responsive, meaning are you going to come when you hear the call? Are you going to be there for them when maybe they're not doing well or they're having, something's wrong? And engaged, emotionally engaged. Are you showing up in a more emotionally stable place, but also you're able to express your emotions in a more primary way. In other words, not secondary is often reactive, right? So in a more primary, heartfelt way. So people can remember the acronym ARE, and that can be really helpful.
Yeah.
And then the other thing I think I would encourage people to do is when you find you're in a distressed place with your partner, pause for a moment and ask yourself, is this a typical cycle? Is this a typical pattern we're getting into? Is it, yeah, every time I yell, my partner leaves. Oh, wow, that's a pattern, the pattern starting. Like maybe pause to kind of take again that aerial view. Is this just a pattern we're getting into? Can I
Yeah.
slow it down right here? Maybe I
Right.
can start over again. I
Right.
came in hot and I yelled. I'm going to come in and I'm going to just soften my voice a little bit. One
Yeah.
little thing that, to maybe try to stop this pattern from happening.
Yeah.
So those two things, ARE and pausing, if I were going to give little tips to people,
Right.
that might help them a bit.
Yeah, it is. It's becoming a curious observer of yourself
Hmm.
and being okay with taking that pause. I always practice the 30-second pause with every client of mine. Like I teach them that right away because many come in with high, it's like high emotion or it's activation or hypervigilance. And they've been living in a survival mode for so long and they picked up these stories like you were saying. And so how important it is to just take that step back, react, it's
Yes.
either reacting in emotion or responding in wisdom. And it's teaching your system how to respond in wisdom. And that's what Dr. Feuerman does. And that's what I try to help do. And so as we
Yes.
close out, I would love for you to just, what message of hope would you want anyone that's listening to walk away with?
Yeah, so a couple of things. One is that change is very, very possible. I want people to have that hope and believe in that. Even in really cases where people are like, we are just so far apart and we don't agree on anything, or they start to feel really, really hopeless. And I have definitely seen couples find their way back to each other with using the EFT approach. And I would
Wow.
encourage people to try it. You're going to learn not just a lot about your partner, but a lot about yourself, which I think is also crucial. I also want people to know that we have a lot more science about love and about relationships than we have long ago, and it's continuing to evolve,
Hmm.
which I think is great. So I think it's being taken much more seriously as a science, and we know that our relationships are critical to our happiness and our survival. So when they're not going well, not much else is going well, right? When you think
Exactly.
about your most important relationships. So we have some really good information about how to help people when they're in these circumstances with the ones that they love. And I would encourage people to seek it out and take advantage of it. And so that would be my message of hope to people out there.
Thank you so much, Dr. Feuerman or Marnie.
Yes,
I thank
Marnie
you.
is fine.
Thank you for
Either
being
can.
here. And for all those that are listening, her book is called Ghosted and Breadcrumbed. Stop falling for unavailable men and get smart about healthy relationships. All the resources we talked about will be in the show notes. And please do not forget to trust in the Lord, guard your heart, and renew your mind. Bye. And now for the disclaimer to make sure you understand that you are responsible for you. The content provided on the Holistic Counselor podcast is for entertainment and informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified mental health provider with any questions you may have regarding a medical or mental condition. Never disregard professional medical advice or delay seeking it because of something you have heard on this podcast. The views expressed on this podcast are my personal opinions and do not represent the views of any professional organizations with which I am affiliated. Call your doctor, 911, or 988 immediately if you have a medical emergency. The Holistic Counselor podcast does not recommend or endorse any specific tests, physicians, products, procedures, opinions, or other information that may be mentioned on the podcast. Reliance on any information provided by the Holistic Counselor podcast, guests appearing on the podcast at the invitation of the Holistic Counselor podcast, or other listeners to the podcast is solely at your own risk. Confidentiality notice. If you engage with the Holistic Counselor podcast by commenting or posting and are a client, please be aware that you may be revealing information that could compromise your confidentiality. Please remember that disclosing your identity or personal details can be linked to your clinical material. As a therapist, I am bound by confidentiality and will not respond to any disclosures of this type on this podcast. I am committed to upholding the ethics and confidentiality of the therapeutic relationship, which extends to all forms of communication in accordance with the laws and professional guidelines that govern mental health professionals. I want you to know that your privacy is of utmost importance, and you are responsible for protecting it when interacting on this platform or any other public forum. Thank you.